Jehovah Witness scenario. Mr. Robert, a 62-year-old, is scheduled for brain tumor excision. Tasks. Explain to the patient the risks of surgery. Ask the patient for permission for a blood transfusion. Hello, Mr. Robert. I'm Dr. Anderson, one of the surgical doctors. I'd like to discuss the upcoming brain tumor operation with you. Can you tell me what do you know so far about the operation? I know I'm having an operation to remove a brain tumor. Yeah, exactly. We're planning to remove the tumor, but it's a risky procedure due to potential bleeding. I'd like your permission to cross-match and store some blood in case it's needed. Is that okay? I won't accept a blood transfusion due to my religious beliefs, even if it becomes necessary during the procedure. Certainly, I'd like to discuss the potential risks if bleeding cannot be controlled during the operation. It may necessitate halting the procedure before complete tumor removal, elevate the likelihood of a severe stroke, and increase the risk of mortality. I know that, and I don't want a blood transfusion. I totally respect your decision. To ensure complete understanding, could you please explain the information and risks associated with refusing a transfusion? Yes, doctor. I'm having an operation to remove a brain tumor, and I may need life-saving blood transfusion. I decided not to consent to any blood transfusion, even if it is life-saving. Discussion. How can you ensure that the patient is capable of making this decision? I will perform a full capacity assessment. I will make sure he is able to retain and analyze information. Whom would you notify about this decision? I would discuss his refusal with the neurosurgeon, anesthetist, and the theater staff. What precautions can be taken? 1. Preoperatively. We'll check the baseline HB and consider measures like erythropoietin, tranexamic acid, and IV fluids. 2. Intraoperatively. We'll focus on quick, precise procedures with good communication between teams. 3. Post-operatively. We'll ensure hydration and monitor HB levels closely. I'd also document the refusal in the notes. How would you conclude the discussion? By asking the patient to recap the information and ensuring their understanding of all the risks associated with the operation, I will then request him to sign a legal document confirming his decision.